Hello friends, I am Dr. Anubhav Gulati, Senior Orthopedic Consultant at GNH Hospital. Today I'll talk about common sports injuries which happen in our day-to-day life. So today I'll focus on knee injuries. So the common knee injuries which happen are injuries to the ACL ligament, the PCL ligament and our menisci. So I'll just brief you initially what are these structures. This is a knee model, and herein we can see so this is the ACL ligament, which is attached from the thigh bone, that is the femur bone, and it goes to the knee, to the leg bone, which is the tibia bone, and this is one of the most important ligament of the knee, which prevents anterior translation or anterior migration of this bone forwards. Then the second ligament, which is the PCL ligament, which is at the back of the knee. This ligament helps to prevent posterior migration of the tibia bone, right? And then we have two semilunar discs or cartilages, which are the menisci. We have one on the outer side, which is the lateral meniscus, and there is one on the inner side, which is the medial meniscus. So these are the commonly injured structures which we normally see in our clinical practice. So ACL ligament is usually injured in when the knee is twisted, and in sports like football or basketball, what happens is basically the foot is planted on the surface and there is a sudden rotational stress on the knee. So that gives rise to tear of this ligament. So these injuries can vary from a simple strain to a partial tear or to a complete tear. Initially what one gets is a severe pain in the knee, which is accompanied by a lot of swelling in the knee, and there is difficulty in walking. Many a times people also report that they heard a pop sound, which definitely suggests that there is a major injury to one of the ligaments. So once this ligament is injured, what are the signs which we look for to diagnose this? So one of the most commonly performed tests is called Ligament test, wherein the tibia is slightly pulled forward to see whether it is translating anteriorly or in front. So that is one sign which we look for. The second sign is called anterior drawer test, or ADT, which is again also based on pulling of this tibial bone anteriorly, and then we grade the injuries according to the degree of migration which we see. So it is graded from grade 1 to grade 3. Another test which is very conclusive is called pivot shift test, and it is very diagnostic test, but usually it is not performed in the acute setting as it is a painful test. It can be done after a few days to weeks when the swelling and pain has settled down. So these are the clinical tests which we normally do to assess the degree of injury to the ACL. Also, patients report that they feel instability in the knee, or the knee gives way, especially when they are trying to run fast or they are trying to change the direction, or in sports like football, when they are trying to cut, the knee gives way. So this is also one of the important sign or symptom which we look for for diagnosing ACL injuries. Many a times there is a tear of the menisci also, or the other associated structures. So to get a full information, we normally ask for an MRI scan, which is a very important diagnostic test for these kind of injuries. And we get a lot of information from MRI regarding the degree of tear of the ACL, any associated injury to the menisci, and what is the status of the bones. So once we have diagnosed an ACL tear, usually in the acute setting, we prescribe rest to the knee in the form of braces, ice pack application. If weight bearing is painful, Then we ask the patient to use a walking stick support for a few days. And the main treatment consists of two types. One is non-operative and the second is operative. So non-operative management is usually done for minor to partial tears, and if the patient is not very demanding and he does not want to do aggressive sporting activities, or his lifestyle does not demand too much stress on the knees, then these kind of injuries or this kind of profile patient can be managed by non-operative treatment also. And the mainstay of non-operative treatment remains initially immobilization of the knee in a brace for a few weeks, and followed by physiotherapy, wherein the muscles, especially the hamstrings, they are they have to be built up to compensate for the deficient ligament, and many times we do see good results by this non-operative management also. However, there is a category of patient wherein they have more functional demand, or they want to do more aggressive sporting activities. In such patients, usually a ligament reconstruction is required in the form of operative management. So these days the medical science has advanced quite a lot, and ACL reconstruction is one of the most commonly performed ligaments worldwide, which has a very good success rate also.